participants for today's National Distance Learning Seminar Series. Today's topic is Monthly Progress Report and speaker is Dr. Manish Bamrotiya. Dr. Manish is currently working as National Consultant ART at CSC Division NACO and is responsible for managing and coordinating care, support and treatment services in the country under leadership of DDG CST. He has over 8 years of experience in the HIV program. He has earlier worked as Medical Officer, Regional Coordinator and Program Officer with the CST Division of NACO. We welcome you, sir, for today's NDLS session now.
Thank you, Divyaji. Good afternoon, everyone. I'm Dr. Manish Bamrotiya from CST Division. So, welcome to this session. Basically, this is based on, I'll be talking about the new monthly progress report format that has been rolled out recently, and most of the ART centers are using that report for filling reports for January 2017. So there have been like few common queries. So we just thought it will be good to have a NDLS session on the same and discussing all the new changes that has been done. So I'll request all the data managers who are listening to this NDLS session to note down few things. So first, you need to go to the site. So basically what format has to be used. So you can go to this particular website, that is naco.gov.in, where under CST division there are options of CST tool. So this is the link you can follow, and then there is one particular link is given for monthly progress report. So that is version 01.01.2017. So you can click this download and get the latest monthly progress report. So I'll request all the centers, so every month they should go to this link particularly and download the monthly progress reports format and then use it for filling the report. So I think that is clear. Then the most common question in the monthly progress report that has been rolled out recently is how to enable macros. So this report is because we have done many logic checks and applied many macros for auto generation of many of the reports that is required at SEX and national level compilation. So we have used macros. So there is a first sheet under in monthly progress report where all these brief instructions have been given, and you have to follow these instructions as per your Excel version. So data managers has to find out whether which Excel version they are using, whether it is 2003, 2007, 2010 or 2013 or onward. So based on their Excel version, they need to follow that particular option that is briefly mentioned here. So I think most of the data managers are computer savvy and that won't be a problem. So first instruction is go through the instruction sheet completely. Then the next thing is finding out a unique ID code for ART centers. Again, there is a sheet provided in the monthly progress report which enlists all the ART centers. So you just have to go and identify your ART center. It is the states and districts has been mentioned there alphabetically. And then you can go to ART center code, find out your ART center. You just can copy the particular unique code which is given there and paste it in your monthly progress report column for unique code, and then following things will be. So this is what I was talking about. So you can for this particular session I am using the filled report from ART center Jhalore from Rajasthan. I'm thankful to them for sharing this report. So first is unique ID code for ART center. You have to go to that sheet and find out this particular unique ID code. Once you fill this, all these informations like 1.2, 1.3, 1.4 and till the state will be auto populated. Then you have to go to type of facility and you have to click on a drop down menu and there will be certain options. For example, there will be ART center, ART plus center, ART, FIART center, centers of excellence. So you have to select the type of facility and then type of institution, whether it is a district hospital, whether it is a medical college or any other from a drop down menu you have to select. and the name and other contact details of nodal officer needs to be given next. So this is the sheet. This is a snapshot of sheet that we were talking about. So it is given on that page here. You can identify your state based on district and state, and then you can copy this particular code and paste it in the column which we have just mentioned. Now entering HR, LAC and CSC detail. This is the second most frequently asked question. So there is only one row visible for each type of HRs, but then more rows can be added using the automated buttons, which we will see in the next slide. So if, for example, if there are two medical officers, you need to enter the details of one medical officer first. As soon as you once you enter that detail, you can click on that blue button and the next row will be visible. And similar to HR details, more rows can be added to LACs and CSC. So first you have to fill the detail of first person or first LAC or first CSC, and then click on that blue button, and then the next row will appear. If you click on blue button without filling the details, then next row will not be appearing. So that is the second instruction that has to be sorry. So this is a kind of manpower details. For example, once they have entered the details of MO, and then all the other details will turn red. So if the first instruction is like, if the post is vacant, you need to leave that cell blank. So you don't need to write vacant, you can leave that cell blank. So we will come to know that the particular post is vacant. Then for other, this is the blue button which I was talking about. So you have to for example here counselor. So as soon as you put the name of first counselor, you can click on this add counselor button, and then next row will appear automatically. And this is working for medical officers, staff nurses, counselors, lab technician, data managers. So basically those HR which has multiple posts or multiple positions. Next is your mobile number. So mobile number has to be 10-digit number. It will take date of appointment. For example, date of appointment, I will request all to fill. If you have a name of particular person, then the date of appointment has to be mentioned. For example, here they have mentioned all the date of appointments for all the staff. As soon as you fill all these details, then date of induction and date of latest refresher training will be asked. So the suggestion is, if induction training has been done, you just write the date, otherwise leave it blank. So these cells will turn red, but it will give us information that so much training need is required at the center. So there are, in the HR field, there are 2 or 3 points needs to be kept in mind. For vacant posts, you need to keep the cell vacant. Once you add one column or one detail for particular HR, then the next columns, next rows can be added by clicking this kind of blue buttons. And for date of appointment, date of induction, and date of refresher training, if done, you can fill the dates, otherwise you can leave them blank and it will be red colored. The next column is for link ART centers and care and support centers. So again, here you have to mention the name of link ART centers, name of medical officer in charge for that link ART center, phone number and email of that particular link ART center. Whether it is a LAC plus, you have to mention yes or no from the drop down menu. As soon as you select yes, this column will turn red, indicating that you have to write the staff name of staff nurse also in this particular column. So if you don't write, it will turn red, or it will be an indication to us that the LAC is LAC plus, but there is this position of staff nurse is vacant. And distance from ART centers in kilometer has to be mentioned in there. If the link ART center is not a LAC plus and just a plain link ART center, you have to write no, and all other details needs to be filled in. Similarly, for care and support, you have to place the details of like name and address of CSC, name of project coordinator, phone number, and email of that particular CSC. Now, there were ART centers who called up and asked like, no, we have 3 or 4 CSCs attached to us. So, but I think there is only one CSC attached to one particular ART. You may be sharing list to other CSCs as well. So you just have to write name of CSC which is linked to your center, which is closest to your center. You may be sharing list with other districts, which other states also, but then the nearest nearest CSC to your ART has to be mentioned here. So I think this first page is clear, and there is this newer addition of columns that many of the centers have not filled correctly. So 1.11 ask about CD4 testing machine. So first question is machine available, yes or no. If machine, so there are, you have to select two drop down, select two options, like any one option of two from the drop down menu. It can be a no or it can be a yes. So in case your center does not have a CD4 machine and it sends CD4 sample to another center, then you have to select no. In that case, these two rows will appear and it will ask unique number of ART center code where samples are sent. So if you don't have CD4 machine, then you will be having some linkages. So you will be transporting your samples to some other ART centers. You have to go to that unique code page and identify the code of that particular center, and you have to write that name, and then automatically that name will appear here. In case for certain reasons in 1 or 2 for 5-6 days or for 1-2 months your linkage has changed, then I'll suggest don't change it and you just mention which is your original or nodal center for CD4 testing, and local time being arrangements may not be mentioned here. If your center has a machine, then you have to select yes. In that case, means voice, so I try to be more clearer, maybe a connectivity issue. So there is one question, we have CD4 machine but not started working, then what to enter? So if it is not functional at present, it has not been installed, you state no, and then you just mention this ART center where your samples are being transferred. So then I am not going to be in detail with this particular column because there has been no change. It is the same indicators which we are using since long. So this is column number 2. 2.1 needs to be equal to 2.5 of your previous month. So after, there was one question after clicking add, there is no link displayed to type second LAC. So again, sir, you have to check whether you have enabled macros or not, first thing. Then second step will be, once you enter the name of first CSC, only then the blue button will work. So you have to first enter the first row completely, or at least mention the name of that LSC, and then if you add that column, then a second row will appear. Number of, I'm really sorry, I might not be able to answer all the questions because there are so many of questions will be asked. So, but we will ensure that after this session, all the questions are recorded and will be answered to all of the ART centers. So yes, so I was there. So in 2.1, you have to check it should be equal to your 2.5 of previous month, and not only total, but for male, female, TSTG, male children, female children, all. So you have to individually match it and compare it with last month's 2.5. It has to be same. 2.2 ask only for new PLHIV registered in HIV care during this month. So it is only this month. Only this month, how many new patients have been registered in that particular month has to be mentioned here, and here you have to write transferred in patients in HIV care. That this includes pre-ART transfer in as well as on ART transfer in. So it is a sum of both the transfer in. So all this information you will be getting from pre-ART register. So this will be from last month's report. This is from pre-ART register. Again, this is from pre-ART register, because irrespective of the fact whether patient is on ART or pre-ART at the time of transfer in, you will be entering that patient in pre-ART register. Column number 2.4 asks about transferred out. Transferred out. So here you have to write not on ART and on ART separately. So this is an information which is available at ART center, and you have to mention how many are transferred out last month, which were on ART, and how many were already on ART when they were transferred out. And 2.5 will be auto calculate. And then you have to, if this value turns red, then you have to check all these values, whether it might be coming as a negative value or some error would be there, then these cells will turn red. So you have to recheck your values in that case. Again, this is the same old format, so I am not going to describe this in detail, but then 2.6 will be reported died till the end of reporting months. Not on ART has to be mentioned separately. LFU patients not on ART but who has visited at least one visit after 1st January 2011, you have to mention it here. Pre-ART LFU are those patients who have not undergone CD4 test for at least last 12 months are pre-ART LFU. You have to mention on ART LFU of the last month. So you have to cross check this figure with, and this will come from your registers, ART registers. This column refers to stop treatment and opted out of the program till the end of this month, and again this will be not on ART and on ART. I just wanted to mention one comment that I have seen many reports, and now centers have, like many have started reporting opted out more and more. So a patient telling that I am not willing to come to your center is not an opted not a stop treatment. Stop treatment will be only if it is stopped on a basis of medical reasons, like due to some medical reasons if patient has been stopped on treatment, then only you have to mention here. And opted out of program basically means that patient is taking care from a private HIV center or some alternative medicines and is not willing to come to program. Thus LFU sitting at home without taking treatment and telling you that I don't want to come the program is not opted out. So that is a thing which we need to clarify. 2.9 are all those pre-ART patients whose last visit was before 31st December 2010. This is a one-time exercise and it cannot increase. Like we have seen reports from other centers where 2.9 constantly increase. So that is not expected. It may decrease if that person comes back, but it cannot increase because we expected, like when this report was rolled out in 2013 or 12, at that time you have done that homework and you have freeze that figure, but we are increasingly finding that this figure is a dynamic figure reported by ART centers, which should not be. So please go through your registers or master line list, identify all those pre-ART patients who have not visited after 31st December 2010 and mention it once and freeze this figure once, and then it cannot increase. So you have to keep in mind this, and this 2.10 is again auto calculated and gives you a figure of active care, and you have to, if it turns red, then you have to recheck the value which has been entered. Then this is a new, I again will request to all ART centers to focus on this particular format. This is for retention Cascade, and there are few changes. So first you need to understand what the current financial year means. For example, for January it will means this January it will mean April 2016 to January 2017. So from starting from the April to the current month is a financial year. You have to give the numbers of only new registered patient. Please do not include transferred in this process. So it is only new registrations at your ART centers in this current financial year. Now this again whole cascade is out of above, like no, you have to read this. For example, out of 2.11a, so out of this, how many undergone baseline CD4? Out of 2.11, how many PLHIV were eligible for ART as per our current national guidelines? So you have to mention. So this figure cannot be greater than this figure. So you have to just mention, like for example here 83 new male were registered. So you have to give out of those 83 how many were tested for CD4. Again, this is easy to calculate. This is available in pre-RT register. Same thing again, from pre-RT register you can calculate this, how many were medically eligible as per guidelines. Out of those who were found medically eligible, you have to mention how many has been initiated on ART till you are preparing report or till the reporting month. So it is a ongoing figure, and next month it is dynamic, it may change. So you have to give the updated figure every month. And then number of PLHIV reported died out of this. So out of those, for example, here they have initiated ART in 65. Out of that, how many have died? Out of that, how many are LFU as of now? And out of that, how many have been stopped treatment or opted out of program? And this question, out of these 65, how many have been transferred out of the ART center? That has to be mentioned. So all these 4 columns are new, and it is basically due to feedbacks from center, this columns has been added. So there were issues like we cannot show our the gap analysis was not visible in previous MPR, so we have added this so we can clearly identify what are the basic reasons or what are the major causes of non-retention in one particular center. So then this number of alive and on ART among this cohort, so out of this 83, approximately 53 are alive on ART. That is evident from this particular format. So then there are 2 other questions, other columns, 2.12 and 2.12a. 2.12 asks total number of patients found eligible for ART 2 months prior to reporting months. So this is only, so I'll take one question again. So there is one question from Madurai ART. Is possible to add the column of gap analysis of pre-ART eligible and started like transfer? Yes, we can think in next revision, but at present it is limited to ART center, on ART patients only. Next question is 2.11a is only for patient not transferred in. Yes, it is only for new registrations. So you do not add transfer ins. Yes, as Prashant ji is mentioning, so you have to be very vigilant. All these columns, all these 2.d to 2.11d to 2.11h, 2.11e to 2.11h are out of 2.11d, so it cannot be greater than this. So yes, coming back to 2.12 and 2.12a, so here we are asking all those patients who were found eligible 2 months prior to reporting month. So for example, your reporting month is January, then November is 2 months prior report. So you have to find out how many patients were found eligible in particular month of November. So you don't have to give cumulative figure. It will be just those patients who have been found eligible in that particular November month or that 2 months prior months. And you have to mention out of these how many have been initiated on ART. So for example, this particular center has registered 3 eligible patients or have found out 3 patients eligible in November. Out of that, as of today, 2 are initiated on ART. So they are mentioning out of 3 we have initiated. So 2 on ART. So I think this is clear. And again, I will take few of questions. So sir, I want to know that if any patient who's CD4 not done started ART, then where I mention these type of patients. So again, I'll request to go through all these things. So please see the CD4 count. We have written out of 2.11a number of PLHIV who have undergone baseline CD4, and here we have mentioned out of 2.11a. So how many who have registered are found eligible of ART? So yes, we acknowledge that there might be, due to some errors or due to some non-functioning of CD4 machine or linkage loss, anything, there might be PLHIVs who have not undergone baseline CD4, and you are finding them eligible. So you can mention here, and you can actually only initiate ART if they are eligible. So you have to first mention all those patients, even if they have not undergone CD4 but are clinically eligible, maybe because of stage 3 or 4, or maybe because ANC status or any other co-infection. Then you have to mention those here, and out of that, then ART you have to mention in this particular field. Next column again is enrollment in ART. So all these columns there are no changes in this column, so I won't go in detail. These are the same columns which used to exist in previous MPR. The point to be noted is 3.1 should be equal to previous month's 3.5. In 3.2, you have to give number of new PLHIV started on ART during this month. It will come from your ART register. Number of PLHIV on ART transferred in during this month. It will again come from your ART register, and then you must check this. Your 3.3 cannot be greater than 2.3. So 2.3 includes all those patients who are transferred in pre-ART as well as on ART. 3.3 is only for those patients who are transferred in on ART. So your 3.3 will always be less than or equal to your 2.3. 3.4, you have to mention number of PLHIV on ART which are transferred out during this month. So again, so this column is auto populated based on the data you have given in 2.4b, and this 3.5 will be auto calculated. Again, if this is red, then you have to recheck all your data. 3.6 is death on ART. 3.7 is stop treatment. 3.7b is opted out of the program, and 3.8 is LFU. So I'm not going in detail of all these indicators because most of you know very correctly about all these details, and there will be an online demo for all these indicators, so you can also refer to that particular demo which will be uploaded on the website. Next is 3.9 that gives you miss status, and 3.10 will be auto calculated based on the figures placed here, and in case this turns red, you need to check all your data, and there are centers where we have seen 3.10 is greater than 2.10, which cannot be. So your pre-ART alive in care includes all those patients who are in pre-ART care as well as all those patients who are on ART care. So if your ART, this 3.10 or alive on ART is greater than 2.10, then your center has done some errors in filling the reports, and you need to check. In 3. So I will again try. There are so many questions, so I'm sorry I'm not able to take all this, but I'll ensure that all are. And so there was one request of asking this demo in Hindi. So sir, yes, we will be preparing videos in Hindi and English, and we are also planning to have in regional languages as well. So I think by next week or so you will be getting all those kind of video demo. So those will, but to cover the larger audience, I will be particularly focusing this session in English only. Sorry for that. So 3.11 will be LAC again. So based on the details filled on page 1, the columns of LAC will appear. So if you have selected yes as under LAC plus, the pre-ART column will be shown as a light colored cell, and you can enter all those patients on pre-ART here and on ART patients here. In case that LAC plus column you have selected no, the pre-ART column will be get darked and you don't need to fill any details in here, and you can only fill ART patients here. So based on the number of LAC rows you add there, the number of LAC's role will be appearing in page number 2. Does section 3 includes transfer in? So yes, section 3 is 3.1, 3.2, 3.3, 3.4. So there is 3.3 column which is for transferred in. Okay, so again, requesting your attention, this is a new column that has been added, which is patients restarted through Vihaan. So again, you have to give data of month prior to reporting months. For example, for January, you have to give data for December. So you have to first column ask about how many patients, list of patients you have shared with Vihaan, not specifically to CSC linked to your center, but to Vihaan program overall, maybe to other district, maybe to other state also. So you have to write all those number of patients who have been shared by you in previous month. The next column or next row will ask you about how many number of patients have been successfully contacted by Vihaan. This data will come from Vihaan or CSC, so you need to ask them, like, I have given you a list of 20 patients, how many have been contacted by you, and they may give you a figure which you need to enter here. And then third column will again come from ART center, and here it has been corrected. It has been corrected where we have in the newer format, it has been written as out of this, how many patients have been linked back. Yeah. So you have to mention it here. So all those patients, whether ART or pre-ART, you have to mention in this here. And when once this has been actually after feedback, we have revised this and we have placed number of patients linked back to ART center. So irrespective of the fact whether they are on ART or pre-ART, you have to write all those patients. So there was one question in 3A.1 column, is both for pre-ART and ART on ART? Yes, it is for all kind of patient, whether it is a on ART LFU, on ART miss, pre-ART LFU, pre-ART due for CD4, medically eligible but not on ART, any kind of patient you have shared that list, that has to come here. Again, requesting for your attention here, this is a PPTCity column and we have done minor changes here. So there are now first changes you have to, like, first point to be noted is the data has to be given only for financial year. So in 4A.1 you have to give number of pregnant women oblique or direct in labor or breastfeeding women registered at your center. So now there can be three scenarios. One scenario can be a patient who is newly diagnosed as HIV and is pregnant, and from ICTC she is coming to your center. So all those kind of women will come in this column, newly registered women. There can be patients who were already registered under pre-ART care and maybe having CD4 more than 500 or 600 and not eligible at that time, and now they are coming with pregnancy. So you have to mention all those patients in this column. So this is already registered pre-ART patient and now coming as pregnant. There can be patients who are already on ART and now coming to you and telling you that patient is pregnant. So all those kind of patients has to be mentioned in this column. And in next row you have to mention out of this, those registered, for example here 19 and here 2, how many have been initiated on ART. So it will be, for this center they have initiated all pregnant women on ART, all those who were previously pre-registered on ART. So they have achieved almost 100% of ART initiation, and so this data needs to be placed in here. So there is a question, may we add transfer in patients in newly registered women or not? No sir, you will transfer in patients are already known to program. If they are transferred in as pre-ART, then you have to place as already registered pre-ART, and if they are on ART transferred in and now telling you pregnancy, then you have to write already registered on ART. The center which comes first to know about that pregnancy will report it, and this will be very rare cases when one takes transfer out from one center and doesn't tell them that she is pregnant, and then coming to other center and telling them that she is pregnant. But in all those cases it will be under these columns. Next is EID. EID has been simplified, and we are asking only two. Again, it is for financial report, financial year, and only two rows are asked. Number of children or in fact registered at ART center through EID during the current financial year. So all those patients who are less than 18 months of age, you have to mention, who are diagnosed positive after EID, and all those children out of that are initiated on ART at your ART center has to be mentioned. So it is very simplified how many you have registered, and how, out of that how many you have initiated on ART within this. So this is for particular financial year. So there is a question. New pregnant woman started on ART but is subsequent week undergoes MTP. How to document this scenario in PPTC? Sir, it does not need. So you have, this is one time occurrence. So once she asks you about pregnancy, she tells the ART center about pregnancy, then you have to document under particular head, and this is irrespective of the outcome of pregnancy. So you does not need to modify if eventually MTP happens. So next, again, very important section is HIV TB, and I'll request all the centers, please call your staff nurses for this particular section. So staff nurses are the key person for filling this this report. And trainings for all the ART centers has been done for this particular format. So this is not a new, yes, it has been recently included in MPR, but separate training under AIC training and daily ATT training, all this format has been explained to almost all the ART centers. So I'll request, so this is not a completely new report, but please pay attention. So again, we are asking here about Cascade. So you need to understand Cascade. So like for example, it asks how many patients you had, and out of this, if there is a series of services that you need to take, how many patient has passed through all the series. So that is particularly we are asking. First row asks you about number of PLHIV attending ART center during the month. So this will come from your patient visit register, and you have to give all the patients who have visited your ART center, irrespective of fact whether ART or whether pre-ART patients. Out of this, how many underwent 4S screening? So it is expected that all our care CCC and other staff, the staff nurses and medical officers especially, does this 4S screening. 4S screening is asking about 4 symptoms of TB, that is, do you have cough of any duration, do you have fever, do you have weight loss, do you have night sweats, and in case of children you will ask about contacts with TB patients. So out of that, like it is expected that you ask all patients, but then you have to give details that how many patients have been screened. So this is screening. Asking them these 4 questions is screening. And then in next question, next column, you have to give, so out of all those where you have screened you have done this verbal screening or 4S, how many are found TB positive, or sorry, positive for that symptom. So if any one of the symptom is present, for example, say cough is present, or fever is present, or weight loss is present, or any one, at least one of them present, then you have to mention those patient as 4S positive or presumptive TB patients. And out of those, all ideally should be referred to TB diagnostic test, which is available as CBNet or other whatever routine investigation you are doing for TB diagnosis, maybe a sputum, maybe a X-ray, maybe a sonography. So all those who are found presumptive TB, how many have referred for TB diagnostic test, and how many are actually tested? So this is asking these questions. So here you can see out of that 830, 22 were having those symptoms. They referred 22 for TB tests, and all 22 undergone TB testing. And then here you have to write like no, out of these 22, how many were diagnosed. They may be under pre-ART care at the time of TB diagnosis, or maybe on ART. For example, for this particular center, they have found one adult male and one adult female, both on ART, and both are clinically diagnosed. So they have the microbiologically diagnosed was confirmation was not available. Maybe CBNet came negative, or maybe sputum came negative, and based on X-ray findings and other clinical findings, they diagnosed them as TB. So all those patients has been mentioned here. So similarly, you have to fill the details whether the patient is in pre-ART or ART, and whether the patient is male, female, TSTG, or a children that is below 15 years, and then total will come automatically here. And here, for all those patients where we have diagnosed ref resistance, we have to place here. And one major change that you have to notice is this: it is for current reporting month. Earlier it was used to have 1 month prior or 2 months prior, but now it is for current reporting month. So for example, you have to place details of your if you are filling a report for January, then this January report has to be mentioned here, and this data will come from TB HIV line list. So there is one question, sir, in 4C.5, all patients referred for TB test to TBCD are not tested for TB. So then you have to write like how many have been tested. For example, if you have referred 22 but only 15 got tested, then you have to write 15 here, and then you need to be you should have some follow-ups or some line listing or some follow-ups on those patients to ensure that they undergo testing. So this is a next section for TB, and it tells you about treatment for TB and HIV co-infected patient, and this is for financial year, again from April to reporting months. Again, the training for this also has been done, so I'm not going to be in much detail, but then you can write in your specific queries regarding this. So total number of co-infected patient enrolled in HIV TB register during the current finance. So this will come from TB HIV register, and in TB HIV register you write down or you enlist all those patients who have TB as well as HIV. So there can be three scenarios. Patient is diagnosed by ART center, so TB is diagnosed by ART center, or patient is reported to ART center as already diagnosed case of TB. So these may be the patients who are already diagnosed at RNTCP and then undergo ICTC testing and then found to be TB and HIV positive. So all those patients, or that patient who are already diagnosed as TB in private clinics and now then referred to you being an HIV patient. So all those patients will be coming here, and all those patients who have been screened by you and diagnosed by you in the line list will come here. Next question is, out of this, how many patients are initiated on TB treatment? So now TB treatment is from government ART center in most of the cases, or some may take from RNTCP. So government you have to mention here, and those who are taking TB treatment from private you have to mention here. Next question is number of TB patients with DRTB initiated on CAT4 treatment. So you have to mention if there are any patients who are ref resistance TB or drug resistance TB, then they will be initiated on CAT4, and you will be referring them to nearest DRTB center, and you have to get that details from them. Next column 4D.4 is number of co-infected patient initiated on CPT. So out of these total who have been diagnosed, you have to write how many have been initiated on CPT and then how many have been initiated on ART. That has to be mentioned. Next is for IPT. IPT has not been rolled out yet, but it will be done soon. So again, it is for reporting month. It is only for reporting months. It is not for financial year, only for reporting months. And then you have to, there are only two columns. One is number of PLHIV newly initiated on IPT during the month, and then number of PLHIV completed IPT during the month. This data can be obtained from the master line list if you fill them correctly as per the training given during HIV TB trainings. Next column has slight modification where we are asking about treatment adherence. You have to write out of those patients who have been assessed by you for adherence, how many had adherence more than 95%, how many had adherence 80 to 85%, and how many had adherence less than 80%, and then total will come. So this is only for those patients where you have done ART, you have assessed ART adherence. So should we mention patient taking AKT from private? And yes, you have to. So there is one question: since when daily dot started, few columns of line list are still applicable, such as date of referral to RNTCP to start treatment. Yes, they are, and also line list has been revised. So you have to just use that revised line list, and then yes, all those columns are very much relevant even today. Like yes, you will be starting treatment at your center, but then there will be some cases of ref resistance and where other cases where you need to refer them to RNTCP. So that's why those columns are there. So again, this is a very important and new section. So this is asking for profile of PLHIV by risk factor. This is a need from Global Fund that we report on this indicator. That's why this has been asked. And again, uh, this is a cascade kind of thing. So you have to give all those patients who have registered in HIV care, initiated on ART, reported die, reported LFU, stopped treatment or transferred out. But for FSW, MSM, IDU, transgenders, migrants, truckers, and serodiscordant couples. So I think most of you are aware on this indicator. So this is female sex workers, this is male who having sex with male, this is intravenous drug users, transgenders, migrants, truckers. Serodiscordant couples are those patients whose spouse is negative. They are positive, but their spouse or husband or wife is negative. So I understand that you may not be having a cumulative data today or like no in this month, but then yes, in this particular month you can not fill this data like no, you can fill only that much data which is available to you, but eventually by March, so you have February and March, we need to come up with a firm identification of this community, which is very important from a programmatic view, and most of our seniors are asking for this. So we need to work on this data, and please try to get this data by March. So by March we will be strictly following this data. This month you have an excuse that you don't have data, but at least for financial year you will be getting this data. So at least for financial year, fill this starting from this month only, and all this for this part of the MPR, give whatever data you have at present, and then by March come up with a firm uh, figure for this particular section. And there is one question: earlier we used to match this with 2.5, but at present we are not going to do this because there might be overlapping between HRG, so we are not matching it with 2.5. There is one question: suppose one patient in multiple categories, then what to do? So then that patient has to be mentioned in all this category, and that's why we are not we are not checking it with 2.5 or so. So if there is one patient who is IDU as well as TG, or who is IDU as well as MSM, then you have to mention both in both the columns separately. Uh, so this is, again, I'm not going to be in detail. This is the regimens. We have tried to capture most of the regimens which are used, but there are two rows for others also which are not visible here, but there are two rows. So in case you give others, then please ensure that you uh, uh, you mention those others as well, and you have to write the regimen wise details here, like how many patients are alive on ART on that particular regimen, and this total should match to your 3.10. This column you are aware of, so that I'm not going to be in detail. This is opportunistic infections. You have to mention all those opportunistic infections which are reported during this month, and here you have to give total number of PLHIV having one or more OI. So this is just not total of this. There can be one PLHIV who have multiple episodes, but here he will be counted only once, so that there is no change. It is almost similar. Again, next is for key side effects. Again, we have added few, but then again most of these are same. In case you have others, you have to write it here. These cells are unlocked and you have to mention it here. For pharmacist, this is drug stock of ART. Please ensure your balance stock for last day of month becomes your opening stock for next month. That is very important. Then you have to mention, I'm not going to be in detail. Here is stock received during the month from SACS or supplier, during months from other ART center, and reusable stock received from patient. So you have to mention all the receipts during this month, those drugs which are transferred out or given to LAC, and then there is consumption at the center and the consumption at the link ART center and total consumption, and this will be, so all centers now we are closely following up that your consumption, this total consumption should match consumption in IMS. So please request to all the pharmacists, please ensure that you do all dispensation through inventory management system only. So there is this ART monitoring, this 3 columns newly added for CD4 and viral load. So you have to write how many CD4 test has been done, and this is already available with lab technician. You have to write how many pre-ART patients were tested for CD4, and you have to write how many on ART patients were tested for CD4 during this particular month. So this is already available in CD4 report. You have to give this. Number of viral load tests conducted during reporting months, if any done, then you have to mention here. At present, routine viral load is not available. You are only doing targeted viral load, so you have to mention if you have that particular information. Now this is a second line report, and this is probably the last section of the MPR. So there were many centers, and there was a check which was placed wrongly here, and this particularly 10 point this 10.A.1 was not accepting a higher figure than 10.1, but that check has been removed now. So if you can go to the website which I mentioned in first slide and download that report has, that issue is being sorted out. So again, here you have to write cumulative number of patients started on second line, second line. So for January, please write all those patients that are on second line at your center, and then you have to give only details for that particular month. So all those who are newly initiated on second line, all those who are transferred in on second line, and all those who are transferred out on second line from your center. So these 3 columns will be only for months. So once you go to the website and download a fresh report, all these changes have been made. So here for January, you write how many patients are already on second line, taking second line at your center. At 10.1, and then this is only for that particular month, and then these are the similar columns to our other MPR: died, stop treatment, lost to follow-up, and miss patients. This third line regimen or 10.10 is only for centers of excellence. So ART centers and ART plus centers where third line is not available are not supposed to fill anything here. Only they have to fill, this is only to be filled by centers of excellence. Last column is for second line April to reporting month. Here you have, and this is only a cascade for SASEP referral. So you have to mention here how many PLHIV were referred to SASEP for assessment, how many have been given appointment for SASEP, number of patients actually reviewed by SASEP, out of these how many were found eligible for viral load, how many actually underwent viral load, how many were eligible for second line, how many were initiated, and how many are alive on second line. This is very very easy to understand if you read all those details of the indicator. This is a plain cascade starting with how many you have referred and ending through all the stages of assessment, reaching to SASEP, assessment by SASEP, viral load eligibility, actual viral load, eligibility for second line initiation, and alive on second line. There is this analysis page. I will request all of you to go through it every month, and it will give you a snapshot of indicators at your center, like how many have cumulative died, how many are LFU. There is this retention cascade will be auto generated, and this retention cascade will be followed in most of the review. For this particular, like 98% have undergone CD4, these many are medical eligibility, this is initiation on ART, and these are retained as on now. So this will be auto generated for your reference. There are some rates and the formula has been automatically put in, so you can have a snapshot on your cumulative LFU rates, cumulative death rates, and also on ART and death and LFU rates for this particular financial year also. Based on this is auto generated based on the data placed by you. So this is I think most of the part has been dealt for MPR, and there will be video for each and every page on NACO's website, so which will be updated and circulated within a week, so you can go there and listen to sections. We will also try to answer your questions which has been asked in the in this particular session. So I'll thank you everyone for listening and sparing time. I know I have this is a long session, and still the things might not get cleared because shortage of time, so I'm really sorry for that, and will try my best to answer all those questions. Thank you very much.
Thank you, Dr. Manish, for such a comprehensive and informative session. Thanks to all the participants for patient listening. I would request all the participants to kindly enter the e-poll which is going to display on the screen shortly.